Honorable Chairman, and learned audience. A very good morning. Tuberculosis is still an endemic disease in our country, and every year it's a very common cause of death in our country. After pulmonary and lymph node tuberculosis, bones and joint tuberculosis is one of the most common topic. So I'm here to discuss about tuberculosis of bones and joints, supervised by Professor Dr. S.M. Idris Ali, Professor and Head, Department of Orthopedics, Dhaka Central International Medical College. So let's proceed to the topic. Throughout the session, I will discuss about sites of involvement of bones and joints tuberculosis, its etiology, pathology caused by bones and joints tuberculosis, clinical features, diagnostic modalities, treatment of bones and joints tuberculosis, and finally, tuberculosis of spine and its management. So, bones and joints tuberculosis mainly involves the spine, and next in order of frequency, hip, knee, elbow, hand, shoulder, bursal sheath, and others. And it also affects end of long bones. Tubercular arthritis is caused in joints. Tubercular osteomyelitis is caused in long and flat bones. Tubercular dactylitis is found in short bones, spina ventosa, tendon sheath, and bursa. Here are some etiological factors of bones and joints tuberculosis. Skeletal tuberculosis is always secondary to a primary lesion. The primary lesion may be present in lung, lymph node, kidney, or other viscera. It mainly spreads in hematogenous route, and the second infection may cause 2 to 3 years later. Let's proceed to the pathology. Tubercular infection leads to chronic granulomatous inflammation with caseation necrosis, as we all know. The response of tubercular infection may be proliferative, exudative, or both. The proliferative response includes chronic granulomatous inflammation, which may heal with fibrosis. And in case of exudative response, some cases of malnourished, immunodeficient patients, it shows extensive caseation necrosis with much cellular reaction. The marginal erosion are also common in tuberculosis of weight-bearing joints like hip, knee, ankle. The necrosed cartilage and fibrinous material from rice bodies in synovial joints, tendons, sheath, and bursa are also found. So finally, tuberculosis can be divided into 4 pathological stages. Firstly, inflammatory edema and exudates, necrosis and caseation, destruction and deformation, healing and repair. There is another pathology called cold abscess. It is formed by collection of exudative products of liquefaction and the reactive exudation. It is composed of serum, leukocytes, caseous materials, bone debris, tubercle bacilli. Here is a photograph showing clinical presentation of cold abscess and deformity caused by it. And this picture shows the MRI findings of cold abscess. Here, the abscess is accumulated. This is another picture of cold abscess, which tracks down from the spine and appears in the gluteal region. The clinical features includes insidious onset, low-grade fever, weight loss, night sweat, and in case of orthopedics, it shows movement restriction, muscle wasting, regional lymph node involvement, and neurological sign symptoms. How can we diagnose a case of tuberculosis of bones and joints? The laboratory investigations are the same, which have already been discussed. We can do Zillnesen stain. This is a positive Montos test. The serological tests are actually non-diagnostic in lesions with a low level of bacilli. It may show the immunoglobulin G or immunoglobulin M titers. The PCR is also an efficient method of diagnosis. It can differentiate between typical and atypical microbacteria. The imaging modalities are the most important topic to discuss in case of orthopedics. The radiography, ultrasonogram, CT scan, MRI, nuclear imaging are the main modalities by which we can diagnose. In case of radiography, we can do anteroposterior and lateral views of involved region, radiograph of the chest. Radiologically, bones and joints tuberculosis may be classified into 4 stages. The first stage is stage of synovitis. The secondly, stage of early arthritis. Thirdly, stage of advanced arthritis. And finally, the stage of healing. This is an X-ray showing stage of synovitis, which shows soft tissue swelling and joint widening due to effusion. This is another X-ray showing stage of arthritis, which is the second stage. It shows narrowing of the joint space and involvement of articular cartilage. It shows a washed out appearance. There is a classical triad called Fremister triad in the second stage, which includes juxta-articular osteopenia. The arrow marks shows the juxta-articular osteopenia, peripherally located osseous lesion, and gradual narrowing of the joint space. In the third stage, we can see collapse, subluxation or dislocation, migration of bone, deformity of joint. And finally, the stage of healing, it includes remineralization, cortical and articular margins become distinct. Let's see some other radiological photographs. In the first picture, it shows Pott's abscess in a patient with tubercular spondylitis. This is another X-ray showing typical radiological picture of an established case of tuberculosis of cervical spine. This is a lateral view of tuberculosis of spine. Here, in the first picture, we can see radio